The Centers for Medicare and Medicaid Services accepted 150 organizations into a new 10-year program called Access. The program goes live on July 5th. What it rewires is fundamental. Traditional Medicare pays for clinician time. Access pays for measurable health outcomes across diabetes, hypertension, chronic kidney disease, obesity, depression, and anxiety. The underlying structural opening that this creates is the part I want to focus on. Under the new architecture, an AI agent that monitors a patient between clinic visits, calls to check in, coordinates a housing referral, or confirms someone picked up their medication can be reimbursed by Medicare as a legitimate care delivery channel. A San Francisco company called Payer Team is on the first cohort. The CEO of Payer Team described the first call that shifted his thinking. A 67-year-old woman living out of her car with PTSD and congestive heart failure spoke with Flora for over an hour. Hour-long conversations with an agent are now routine. The companionship is the intervention. The clinical capability had been sitting in pilot deployments for years with evidence that it works. What was missing was a way to sustain it at federal scale. Access is that way. If you or someone you love is managing a chronic condition, and the program covers 6 of the most common ones in the country, the institutional layer of how that care gets funded just opened to a new kind of provider. An agent that walks alongside a patient between visits, that calls, that asks how they're doing, that catches the warning sign before it becomes a hospital admission. The trajectory this points to is something that previous coverage of AI healthcare consistently missed. The bottleneck has always been institutional. The capability had arrived, but the institutional layer was the thing not yet built. Access is the federal government building that layer.